Town Hall. And with us today is our from our VA Puget Sound. And before I give the floor to the chair of the governors committee, I would like to lay out some housekeeping rules. So if you are not speaking, please put your microphone on mute. And we also ask that we refrain from asking questions during presentation. Just let us hear every one of our speakers, because we have devoted time for a question and answer towards the end of the presentation. So thank you again, and let me give the floor to our chair, Bob Wallace.
Well, good morning. I'm Bob Wallace, and I'm chairman of the Veterans Advisory Affairs Committee for the Governor. With me today are my fellow VAC committee members as well. Thank you for participating in our virtual town hall meeting today. Today we are going to hear from the VA Puget Sound Health Services. We will learn the changes within the VA system, care veterans are getting in VA facilities, as well as community care, homelessness, suicide prevention, and disposition of COVID-19 vaccines, etc. Now, as Lisa said, if you have any questions, please feel free to type in the chat box or send an email to Lisa, and that's LISAN at dva.va.gov. And please help me to welcome the leadership team from the VA Puget Sound after Alfie. Good morning, Alfie.
Good morning, and we have a lot of people online today. I am Alfie Alvarado, and I'm the director of your Washington Department of Veterans Affairs. My remarks are going to be very short because we have an exciting and amazing lineup of the senior leadership of the VA Puget Sound healthcare system, and I want to make sure that they have every possible opportunity to talk to their programs and the current state, and also to be able to answer questions. And this is an opportunity for everybody to be able to hear out what's taking place in our region, but also the information that is going to be shared today is applicable to all veterans. So we welcome those of you who are from not from the Puget Sound care area, but also from other areas of the state. And there will be some things that may or may not be applicable to you because they're part of the I-5 corridor region and the areas that are catchment for the Puget Sound healthcare system. Nevertheless, a lot of information is going to be consistent. So without any further ado, we'll just continue with our agenda. Thank you.
Good morning.
Yes, Tammy, it's gonna be Dr. Catherine Kaminetsky. I'm so sorry, ma'am, if I didn't pronounce your name correctly.
You get
welcome and thank you.
Oh yeah, thank you for inviting us, and you get an A+ in pronunciation. So good morning, I'm Catherine Kamenetsky. I'm the Chief of Staff at VA Puget Sound, and I just wanted to thank you all for inviting us to this meeting. We're really excited to share updates on a number of points that we think you all will be interested in. I want to introduce the folks on my panel, say a few words, and then turn it over to them to share their information. We will be hearing from Dr. Lauren Best, who is our Deputy Service Line Leader for General Medicine Service. She will be speaking to us about the COVID-19 vaccine rollout. In addition, we have Dr. Simha Reddy, who will be discussing our activities in supporting homeless veterans during the pandemic. Dr. Reddy is the Homeless Primary Care Medical Director. We also have Dr. Jesse Markman, who is the Associate Chief of Staff for Mental Health, and he will be going through our mental health and suicide prevention programs and services. We have Dr. Chris Vandermarker, who is the Service Line Leader for General Medicine, and he will be talking to you about changes in primary care including some of our new clinics that we have coming up in Edmonds, Olympia, Puyallup, and Everett, and also closure of our Valor healthcare operated clinics in Bellevue, Federal Way, and Lake City. And then finally, we will hear from Ms. Susan Willard, who is our Director of Community Care, and she will be providing an update on our community care services. So first, I just wanted to tell you that our care and safety of veterans is really our #1 priority during this unprecedented pandemic. And part of that mission is served by making sure that our staff also are safe. We very much appreciate the continued trust in VA Puget Sound as we partner with our veterans in meeting their care needs. And we're really thrilled about being able to provide the vaccine. Vaccine arrived at VA Puget Sound on December 15, and the first vaccination happened on December 16th. So we have very much hopped on that mission and have some exciting news about that. Dr. Best will be providing more details about the rollout, but I'll just tell you that we are providing vaccines at Seattle, American Lake, Silverdale, Mount Vernon, and limited in-home and homeless shelter-based vaccinations. We have made a lot of progress on vaccine rollout. We've administered, let's see, as of today, we've administered 12,404 initial dose vaccines, of which 5,271 were veterans. We're very hopeful about the trends that we're seeing nationally in terms of the decrease in COVID-19 infections and also in the increase in vaccine supplies. And I will tell you personally, I get chills on a regular basis when I'm in the vaccine clinic and seeing vaccine not only go into arms, but going into the correct arms. And that we have a very tight process for making sure we don't waste a drop. We continue to proactively contact veterans to make vaccine appointments when it's their turn. We don't accept walk-ins. It's really by appointment only. And I'm going to give you a couple of phone numbers for those of you who wish to write things down. Eligible veterans can call the following number to schedule an appointment. The number is 206-716-5716, or they can contact their primary care team. I have another phone number about to come up, and that is our veteran COVID vaccine hotline. That is a local hotline that we have set up that has information about vaccine scheduling eligibility. That number is 206-277-4040. Any healthcare eligible veteran is eligible for vaccination, regardless of whether they get their primary care here, regardless of their disability status or their service connection or housing status. Really, eligibility for VA healthcare itself is determined by our eligibility office, and that is in accordance to national VHA criteria. We have been offering vaccines to homeless veterans, to our congregant living homeless veterans, and that includes on-site vaccination through site visits by our homeless patient-aligned care teams or primary care teams, and Dr. Reddy will give you an update on that progress. We've also been addressing vaccine hesitancy amongst our communities across the nation, and trying to make sure to reach out to populations that might have some hesitancy about getting the vaccine. We've been studying differences in vaccination rates or acceptance across different populations to make sure that we're really addressing gaps and trying to prevent them. We do follow the Washington State guidelines with respect to the phases of opening. And so we pay attention to the phase 2 guidelines that we're in right now. We do not accept walk-in patients for care other than emergent needs. And we'll hear some about how we're providing care to veterans in novel ways. I know that Dr. Markman is going to be talking about mental health care needs, and we're really thrilled to share that our virtual mental health encounters have increased by more than 350%. There are a lot of veterans who are very excited to talk to us through video, chats and through telephone calls. It's just a way of keeping them safe during the pandemic. Along with the vaccine rollout, we've been really working hard getting ready to open up 3 new community-based outpatient clinics. And hopefully we'll have some of those opened in April of 2021, and 1 clinic expected to open later this year in Everett. And Dr. Vanderwalker will be going over those details. I think finally, our last presentation will be on community care. We are absolutely aware that we have some phone challenges for our veterans, and we recognize that that is a significant issue, and we are working on that. It is really not acceptable. So we are diligently working on getting our phone system fixed and improving the responsiveness of calls so that veterans get their answers and concerns addressed promptly. So Ms. Willard will be talking a little bit about this and how we can address the experience of veterans who are just trying to get information about their care, right? All right, with that, I will turn things over to Dr. Lauren Best, who's going to share more details about our COVID-19 vaccine rollout. Dr. Best?
Yeah, thanks, Dr. Kamenetsky. Good morning, everybody, and thanks for inviting me to participate on behalf of our vaccine operations team. We know you have a lot of questions, and information is changing quickly. The vaccines we are distributing mark crucial steps in getting COVID-19 under control. To provide a bit of background, vaccines help train the body's natural immune system to recognize and fight a specific disease. When a virus is introduced to your body for the first time, your immune system mounts a defense. This includes making antibodies that help kill or neutralize the virus. If you're exposed to the same virus again, these antibodies will help your immune system recognize and fight the virus quickly. We have treatments that help reduce the effects of COVID-19 infection, but a vaccine that helps prevent people from becoming infected is the best way to slow or stop the spread of the virus. Vaccines protect you and the people around you. Protecting whole communities from diseases like COVID-19 is an important reason for everyone to get vaccines. We call this community immunity. When enough people get vaccinated, a virus can't spread as easily from person to person. This means that everyone in the community is less likely to get infected. Even if some people do still get infected, there's less chance of an outbreak that causes many people in the community to get sick at the same time. This helps prevent issues like too many people needing care at once and not having enough hospital beds or healthcare providers. Data shows that some communities have been disproportionately affected by COVID-19. These include Black, Hispanic, and Native American communities. Members of these communities can help protect their families and friends by getting vaccinated. We are administering both the Pfizer COVID-19 vaccine as well as the Moderna COVID-19 vaccine. Data from clinical trials shows that the 2 authorized COVID-19 vaccines are safe in people who have been infected with the virus in the past. If you're currently sick from COVID-19, you should wait until you're recovered and you're finished with isolation to get a vaccine. Both of our vaccines require 2 doses, given 21 days apart for Pfizer and 28 days apart for Moderna. For each of these vaccines, veterans need to get both shots for the vaccine to work. Get the second shot, even if you have side effects after the first one, unless a healthcare provider tells you not to. Vaccine experts will need to continue studying the data to determine when people will need more vaccine doses to maintain protection from COVID-19. And veterans can change their minds about getting a vaccine at any time. Given the limited supply of vaccines, we simply ask veterans to contact their healthcare team as soon as possible, and this will allow us to offer the vaccine to another veteran if you change your mind. Now, for our local rollout, we continue to follow VA COVID-19 vaccine distribution plan, which was released on December 15th, 2020, to ensure a safe, evidence-based, and equity-focused vaccine rollout for VA frontline workers and for veterans. We continue to work closely with the Centers for Disease Control and Prevention and our other federal partners to provide the COVID-19 vaccines. The vaccine distribution plan addresses vaccinations for veterans, staff, and other federal partners, and includes a risk stratification framework for identifying the populations at the highest risk to receive the vaccine first. We continue to follow VHA and CDC guidelines for determining who is at high risk of severe illness or death from COVID-19. Factors that may influence the risk of severe illness include the following things. Age. Risk of severe illness or death from COVID-19 increases with age. Existing health problems. People with certain health problems like diabetes, heart disease, or obesity have a higher risk of severe illness or death from COVID-19. Other factors that raise a person's risk of severe illness or death from COVID-19, such as living in a nursing home or other group living facility. It's important to understand that we need to vaccinate the most vulnerable veterans first, which means that not all veterans will be eligible to get the vaccine during this initial rollout. And as Dr. Kamenetsky mentioned, supplies of the new COVID-19 vaccines continue to be limited. Veterans actively being scheduled now for the vaccine at this time include veterans age 60 and older, and our next priority group will be veterans ages 55 and older. Your VA healthcare team will contact you for scheduling when you're eligible to get a vaccine. While there is significant debate around the possibility of delaying second dose vaccines across the nation, we continue to follow Centers for Disease Control and Prevention recommendations. Additionally, veterans are encouraged to get their second vaccine dose at the same place they received their first dose. Importantly, Washington State and VA vaccine eligibility phases may differ. We're encouraging all veterans to get a vaccine as soon as they are eligible, including through the Washington State Department of Health if they're eligible sooner through that pathway. And all veterans and caregivers need to know that they should never be charged a dime for vaccination. It is federally prohibited to charge the patient directly. Also, insurance like private insurance, Medicare, Medicaid, etc., will not bill the patient for cost sharing like copays for a portion of the COVID vaccine administration fee. Thus, the veteran should not ever need to file for a reimbursement of the vaccine administration fee from the VA because you should never be billed by the provider or any other insurance, such as Medicare, in the first place. Even after eligible veterans and caregivers receive a COVID-19 vaccine, they still need to wear a mask that covers their mouths and noses when they are in a VA facility. They'll also need to follow other VA safety rules like practicing physical distancing. In the meanwhile, veterans with COVID-19 or COVID-19 vaccine questions should call if they are eligible to schedule or contact their primary care team. The phone number is 206-716-5716 for scheduling. You can also call our local veteran COVID-19 vaccine hotline at 206-277-4040 to get daily updates about our current vaccine scheduling eligibility. Finally, you can visit the VA Coronavirus Vaccine FAQs webpage, which is www.va.gov/healthcare/COVID-19 vaccine. And maybe we can put that in the chat. And you can also visit www.pugetsound.va.gov for our local operational updates on COVID-19 and the vaccine. For all non-COVID-19 vaccine-related healthcare concerns, veterans are asked to call us at 1-800-329-8387 or reach out to your primary care team. Thank you for your attention.
Thank you, Dr. Best. Next up, Dr. Simha Reddy is going to share our support of homeless veterans. Dr. Reddy?
Hi, folks. My name is Simha Reddy. I'm a medical director for our homeless Packer primary care team. It's nice to see a couple familiar faces. So first, I want to say that those veterans who are experiencing homelessness are some of our most vulnerable, just across the board. And we've worked really hard over this last year to protect them during the pandemic.
Hey, Simha?
Really, yeah.
Dr. Reddy, I'm so sorry to interrupt you. This is Kathy Kamenetsky.
Yes.
You're coming across a little bit in and out. You might want to turn off your video, sacrifice the video so we get more of the audio, please.
Gotcha.
Thank you so much.
Can folks hear me right now? How does that sound?
Yes,
Kathy?
I think that sounds better.
All right. Thank you so much for letting me know. So what I was saying was that those veterans who are experiencing homelessness are some of our most vulnerable, and we've worked really hard over this last year to try to protect them. There was a early recognition, both locally and nationally, that because of the congregate nature of many homeless facilities, as well as the high level of medical disability within this population, that they were at very high risk from COVID. And then that early recognition was important because it gained us some important new tools to care for our homeless veterans. One of the most important of those was funding to be able to move high-risk veterans into hotel rooms. This meant that we could decompress our transitional housing programs very quickly and allowed our rapid rehousing programs, our supportive services for veterans and families program, to get veterans into to safety as quickly as possible. To support those veterans in hotels, in addition to the on-site case managers from our partners and grantees, our homeless primary care team has been visiting, and in fact, I'm sitting at one of our hotel outreach sites now, and we've been going out about once a week or so to make sure folks are doing well in these places. Something else that's been very helpful this last year is that we've been able to broaden our eligibility for our HUD-VASH vouchers. That means we've been able to move veterans more quickly from hotels directly into homes of their own permanently. And to help with all this, we've been able to provide smartphones to veterans in need, making sure that they can stay connected both around housing and also around and to make sure that they can participate in virtual care, both physical and mental health care. There's been a couple of other several COVID-specific programs for our homeless veterans. First up, we converted our American Lake domiciliary into our own isolation and quarantine facility. It's got meals, on-site nursing, and supportive mental health care, and this has allowed both our homeless veterans and really any veteran without the home support they need to be able to isolate in a place of safety when they have COVID. Next, we were able to create a COVID testing program, very similar to the public health's approach, where we would take testing to our transitional housing programs to help ensure people are being screened regularly for COVID. And then finally, over these last 6 weeks or so, we've been able to take the COVID vaccine out to our hotels, as well as our transitional housing programs and some of our highest risk supportive housing buildings. So we've actually finished up the second vaccine at most of these places, and we've started transitioning into taking vaccines out to our really high-risk veterans who are now in permanent supportive housing, but probably would never make it into the hospital on their own. And finally, I want to say how important partnership has been in all of this, specifically the WDVA. The WDVA manages two of our largest GPD programs, transitional housing programs. This is based out of the soldiers' homes at Ording and in Retzel. And the work has been frankly incredible. They have not had any significant outbreaks in these places. They've worked incredibly hard to minimize risk, coordinate testing, and got vaccines to folks. I think that's I just want to point out how impressive that's been. And then our other transitional housing partners, like the Salvation Army and Catholic Community Services, really coordinated very closely with us to prevent outbreaks at other sites. Some of our SSVF or rapid rehousing partners, like Catholic Community Services or Sound Mental Health and the YWCA, really made a big transition from doing rapid rehousing case management to providing meals and shelter at these hotels. And that was a big shift, and they've done it very impressively. Even our local housing authorities, like King County Housing Authority, really tore down a lot of barriers in terms of paperwork and other things early in the pandemic. This meant that we could streamline getting veterans housed. And then finally, two local organizations, Catholic Community Services, as well as Pioneer Human Services, we've partnered with them to build two new permanent supportive housing buildings, one in Capitol Hill in Seattle, and the other in Kent. and both of those are opening now. And that means 76 veterans who are very vulnerable are going to be housed. And I think that's really a testament to the hard work of both our partners and our case managers. So overall, I think we've done our best over this last year, and I think we've gained some important new tools to help take care of our homeless veterans. I'm hopeful some of these tools will remain as at the end of the pandemic to allow us to continue to care for veterans in this predicament.
Thank you so much, Dr. Reddy. All right, next up, we are going to have Dr. Jesse Markman speak about our mental health and suicide prevention services and programs. Dr. Markman, are you on the line?
I am, yeah, thank you. I'm really pleased to be here and to join this meeting and to have the opportunity to talk about the services and care offerings we have within mental health at VA Puget Sound. In particular, I'm going to be highlighting how we've adapted our care during the pandemic, and then our efforts around suicide prevention. So in general, we offer a wide array of services, including acute inpatient care, residential, ambulatory care programs, addictions treatment, emergency and urgent care, and voc rehab services. Our mission is really to provide an appropriate level of support and treatment to assist veterans in recovery and their recovery process within mental health and addictive disorders, and to maximize their overall level of function and satisfaction in their life. So our care is veteran patient focused and culturally sensitive and cost effective, and it's really supported by our clinical programs, our educational programs, and our research programs. So 2020 saw a really massive shift in the way that we can and are able to deliver care. Right now, so I mean currently, more than 90% of our mental health visits that we provide are completed with telephone or televideo visits. And our rates of appointments within the VA Video Connect, which is our name for our platform for providing virtual care to veterans, have actually increased by more than 2,000% in fiscal year 2020, which is really shocking. And I can say from my own personal experience as a psychiatrist, it's been really incredible to be able to reach veterans whom we were really never able to reach before, or who didn't feel that they could access care before. We're able to provide telehealth equipment with internet access to veterans who need it at no cost. And we're really happy about that too. So we do continue to provide in-person care to those veterans who need it urgently or emergently, but we're really thrilled that veterans are embracing our virtual care options from the convenience of their own homes. So the COVID-19 pandemic also forced us to temporarily suspend our residential care offerings. As Dr. Reddy described, we've been using the domiciliary building for other purposes, which we're very supportive of. We needed to then pivot have our providers pivot care offerings to maximize intensive virtual treatment offerings for those veterans who could benefit from that. And we know that this is not a perfect substitution for residential care. We're really looking forward to, and I live in a land of really what I like to call psychotic optimism. So I imagine that we're going to be able to return to being able to provide cares in the ways that best serve veterans in the future, but we're really looking forward to reopening residential care type offerings in a limited way later in 2021. So VA Puget Sound also remains committed to suicide prevention, right? And we recognize that there's really no single pathway into or away from a suicidal crisis. And because of that, we really need to remain sensitive to the stressors and risk factors that are facing veterans, and we need to strive to provide early and effective intervention. We also need to acknowledge that our work doesn't stop with a death by suicide, and that we have work to do then too, and to be able to support veteran family members, community members, and their care provider. So, you know, these goals are really a constant focus for us and have been over the past year. So over the past year, our suicide prevention team provided local follow-up to more than 2,800 calls to the Veteran Crisis Line. That's the highest number we've encountered over the past 10 years. And nationally, VA Puget Sound is consistently in the top 5 VA facilities with regard to the number of referrals received from the Veterans Crisis Line. In addition to this, we maintain a regular caring mail contact program with all veterans who have high-risk flags and those flags that have been removed within the past 12 months. So for people who are not terribly familiar with this, caring contacts is one of the few interventions that's been shown to reduce future suicide-related behavior. And it's low cost and simple. And so what it involves is veterans receiving cards from VA providers that say that we are interested in their care, we hope they're doing well, that we are happy to discuss with them any options they want to take advantage of, and provide some contact information for how they can get involved in care. So in the past 6 months, this resulted in more than 300 caring cards being sent to our highest risk veterans across the Puget Sound region. So we also understand that suicide prevention can't only happen within the walls of the VA, right? That it's really a community-focused and public health approach that's needed. Because of this, our community outreach and education continues to be a major focus of our suicide prevention efforts. And even with the limitations from the pandemic, the suicide prevention team was able to pivot to virtual outreach and completed an average of 20 community outreach events per month. And they reached over 5,800 individuals across our community. So that included veterans, agencies, and organizations that serve veterans, state agencies serving veterans, and veteran programs with local Indigenous communities. So thanks very much.
Thank you, Dr. Markman. So next up is Dr. Christopher Vanderwalker, who is going to talk to us about our primary care expansion plans. Dr. Vanderwalker.
Greetings. Thank you so much, Dr. Kamenetsky. I'm here today to share with you our exciting plans to expand our primary care footprint in Western Washington to better serve veterans at locations that are more convenient to them and closer to their homes. On December 4th, 2020, we announced plans to open 3 new community-based outpatient clinics in Edmonds, Olympia, and Puyallup by late spring this year, and another in Everett before the end of calendar year 2021. We also have submitted a request for a proposal to site a CBOC in the Auburn area, but do not yet have a firm schedule, timeline, or location. We're also exploring new sites in Woodinville and ultimately a permanent home in the Olympia area. To support this change, VA Puget Sound did not renew its contract with Valor Healthcare and closed clinics in Lake City, Federal Way, and Bellevue on January 31st, 2021. During the period from February 1 through the opening of our new CBOCs, VA Puget Sound has virtual teams in place with primary care, social work, pharmacy, nutrition, and mental health ready to go for veterans who receive care at one of the 3 Valor-operated clinics. We have proactively contacted the approximately 11,000 veterans who have been receiving care at one of the 3 clinics that closed and ensured a smooth transition, and all of those 11,000 have been transferred to new locations based on their zip code and proximity to the nearest Puget Sound site. The new primary care team assignments are already completed. Some veterans have asked to change sites, and we are working through their requests one by one as they come in. If a veteran did not receive a letter, they have already been reassigned, and they can find out their new team by logging into My Healthy Vet or calling 1-800-329-8387 and asking to speak to their primary care clinic location. The new CBOCs are part of a larger system redesign to better serve Western Washington over the next 4 to 5 years. In addition to the CBOCs in Edmonds, Olympia, Puyallup, and Everett, we're exploring the new clinics we just referenced in Auburn and Kent, and another in the North King County area. Together, the new clinical footprint these clinics will create allows VA Puget Sound to directly serve Everett and Olympia, 2 major metropolitan areas in Western Washington that have no VA facilities currently. Additionally, it will create new capacity in our areas of highest growth, which are in South King County, Pierce counties, as well as better outreach our rural veterans in North King County. Immediately, the shift from Federal Way to Puyallup and Lake City to Edmonds overlaps coverage substantially. The closed Bellevue location will be served by the VA Puget Sound Seattle campus and future clinics in Auburn and Woodinville to the south, north and south, respectively. Our 3 new community-based outpatient clinics in Edmonds, Olympia, and Puyallup are all larger in capacity than the now closed Bellevue CBOC. When we say expansion, it refers to our regional ability to serve more veterans with more services through more modalities. So the new footprint of VA Puget Sound will have more clinical sites serving a greater number of total patients, but the specific locations are shifting. We already have hired and put in place the staff to support this transition from the contracted services. Those teams are currently operating and they all have full panels. They are currently virtual clinics because our new sites in Edmonds, Olympia, and Puyallup are completing their final tenant improvement upgrades to meet VA standards for security and IT. During this gap, while we have virtual clinics but no sites open, veterans are assigned to locations and have the opportunity to be seen face-to-face for urgent issues at any of our CBOC locations. As a virtual team member, they have access to a dedicated pharmacist, primary care mental health integration specialist, social work, and nutrition services. In addition, laboratory imaging and clinical needs at the American Lake, Seattle, Mount Vernon, and Silverdor campuses are available to anyone. Existing orders, medications, and consults all flowed during the transition from their prior assignments to the new teams. Patients should not have any disruption in their access to medications, specialty services, or other VA resources. There are many options for patients who were enrolled with primary care at one of the clinics that closed. There's availability at the Seattle and American Lake campuses. We have our community-based outpatient clinics in Mount Vernon, Port Angeles, and Silverdale. And our new virtual clinics at Edmonds, Puyallup, and Olympia are taking patients and will physically open in late spring. Our new Everett CBOC is currently under construction, and we hope to have that open by the end of this year or early next. Additionally, enrolled veterans also have the extensive community care options available under the Mission Act, which include urgent care at locations such as Indigo, Concentra Immediate Clinic, University of Washington Neighborhood Clinics, Evergreen, and SuperTrack walk-in clinics. Veterans can find a location or an in-network community care provider for urgent care issues at www.va.gov/find-locations. That's www.va.gov/find/locations. We also continue to maximize personalized virtual care options. We know these services have been a valuable link to our veterans during this challenging time, providing increased access to care regardless of where they live. For specialty care, referrals are sent to the specialty service at the Seattle campus typically, and they work with the individual veteran to determine the best modality for care. Care can be delivered sometimes via the phone, sometimes via video, or sometimes face-to-face. Veterans also sometimes may be referred to the community care if that is in the best interest of the patient based on their clinical case. The community care team, who you'll hear from next, can be reached at 206-277-4545 or 206-764-2876. If the first one is busy, veterans are encouraged to call the second one. Services at our new clinics opening in late spring are going to include the full primary care, in-clinic and home-based, laboratory services, mental health, social work, clinical pharmacy specialists, telemedicine, and nutrition. To address a few specific questions that come up frequently, there are going to be labs at each of our new clinics. Those labs can draw blood, collect urine samples, and provide screening for COVID-19, influenza, and other issues, including A1C and routine blood work. While there is one clinical pharmacist on-site at each of the new CBOCs, there will be no on-site pharmacy, so no medications will be dispensed. The clinical pharmacy specialists work with veterans on specific chronic diseases like diabetes or congestive heart failure. Veterans may request refills, order and ship meds using My Healthy Vet or the RX Refill mobile app. If a veteran currently has a primary care mental health integration provider at one of the closed clinics, that veteran will be able to complete their episode of care with their current primary care mental health integration provider, despite this transition. For the Everett Clinic, which is opening later this year, services will include primary care physical therapy, occupational therapy, and also advanced diagnostic imaging. hopefully to include ultrasound, echo, CT, MRI, social work, mental health, nutrition, pharmacy specialists, and possibly more advanced mental health services and homeless care. Finally, across all our sites, VA Puget Sound provides transportation services to VA appointments for eligible veterans living in our service area, which includes Puyallup. Veterans may access the VA transportation program through their VA provider or by calling the travel office at 206-764-2120. That's 206-764-2120. And that's all.
Thank you, Dr. Vanderwarker. Next up, I invite Ms. Willard to wrap up things by highlighting community care. Ms. Willard.
Good morning, everyone. My name is Susan Willard. I'm a retired Army veteran and the VA Puget Sound Director of Community Care. I want to thank you for this opportunity today to join the Washington Veterans Affairs Advisory Committee and to share some news about our community care service line. Today, I'd like to provide you with an update on community care, including how we got here, where we are, and where we're going to support veterans seeking care in the community. With the COVID-19 pandemic beginning in 2020, routine care and surgeries across the nation were placed on hold. This was in anticipation for treating increasing numbers of patients with COVID-19. As a result of this hold, VA providers and community providers had reduced capacity to see patients. And as this care was deferred, we were limited to treating only the very sickest patients and those in need of urgent care. Deferring care has created a very large backlog of requests for care in the community. We're currently working on a consult backlog of greater than 31,000 consults, of which to date, 17,460 veterans have scheduled appointments. We are aware of delays some veterans are experiencing in getting their care and how frustrating this can be. Our greatest challenge is responding to this large volume of backlog for care in the community. I want to assure you, community care teams are working tirelessly to prioritize urgent consults and to reduce the time to scheduling these appointments. So, as you can see, our work is cut out for us. So here's what we've been busy doing to address this high demand for care in the community. First of all, we've authorized overtime for our teams throughout the week as well as weekends to address the backlog and work it down. We've worked with IT recently in mid-January, modifying and reconfiguring our phone lines to expand the capacity to accommodate the increased numbers of calls. We have dedicated staff answering phones as well as dedicated staff reaching out to veterans to schedule their care. On the 6th of January, we expanded an option in our current contract with TriWest, our third-party administrator, to assist in processing consults. They're processing over 4,500 each month. We're also working with TriWest to identify geographical locations where there are gaps in the provider network to recruit providers in the community in these locations. Ultimately, our goal is to answer the phone in seconds so that veterans' concerns may be promptly addressed. Currently, when you call community care, you will likely experience an extended waiting time. We know we still have a significant issue, and this is unacceptable. Your calls are important to us, so please, when you call, do not hang up. We ask for your patience as we continue working to reduce the time waiting on hold as well as the time to get your care scheduled. If you do have an urgent clinical concern, do not hesitate to reach out to your provider to let him or her know that they can reach out to us. You may always consider discussing with your provider options for receiving care at the VA versus in the community. Alternatively, VA services include telephone, video visits, and Often these may be scheduled sooner than face-to-face encounters. Please be sure to discuss these alternative options with your provider. Just to let you know, an average length of call on the waiting queue might be as long as 45 minutes. And then just to give you our customer service line for veterans, and I can put this in the chat as well, 1-800-329-8387, extension 4545, and 253-582-8440, extension 4545. Thank you again for the opportunity to share this information.
Thank you so much, and many thanks to Drs. Best, Reddy, Markman, and Vanderwerker, and thank you, Ms. Willard. I think we are okay with opening up for questions.
On your screen, there's a hand. So if you would like to ask question, please click on that so that way we go. So the first stop is Miguel. Miguel, you're on.
Good morning, ma'am. My name is Padilla. I'm part of the VLC, Washington State Attorney Council, and I'm also the chair for Touch with Care Support Group. And my question is, I was reading this morning, Johnson & Johnson got approved by the FDA. Their thing to do of the vaccine is supposed to be one shot, only 7% effective. And my question is, it's VA trying to implement all the 3 shots, Moderna, Pfizer, and Johnson, or what they're using right now for the veterans?
Dr. Best, would you like to handle that question?
Yeah, happy to. So VA Puget Sound right now has both Pfizer and Moderna, which are the 2 vaccine options that are currently FDA approved in the US. So we may get Johnson & Johnson in the future. It's not clear yet since this information just came out. So I think the answer is to stay tuned, and we will give you more information when we have it.
Next up is Cassandra Clark.
Hi. First of all, thank you for doing this. I have a question for Ms. Willard about the community care. I have actually had very positive experiences. Oh, back up. I'm the 9th District Vice for the American Legion. We are Okanagan Valley, which is very rural. I'm 180 miles away from the Spokane VA. So for us, it's a really big deal that this is available to us. And overall, what I'm hearing is people are really pleased with the care they're getting from their community PCPs. The one issue that I keep hearing about is about authorization numbers and working between the doctors and their offices and the VA to get that kind of thing straightened out. What I hear a lot of is that the doctor's offices are not receiving training for that paperwork. Is there something we can do to facilitate that? I think it would dramatically reduce phone call backlogs, miscommunications, billing issues, which would probably keep a lot of people off the phones.
Yes, I think I can address your question. So I think the first thing is to know is that TriWest, our third-party administrator, has the responsibility to recruit and train the network providers. I did have a call not too long ago, maybe a few weeks, with the CEO at TriWest and talked about this training. And he, first of all, assured me about their great training program, and I'm sure that they do have a great training program. However, I have some of the same concerns that you have in that I'm hearing much of the same kind of things, that providers are not aware of various things that they need to do. So I think there's a lot of things that they get in writing. I think that there is an expectation that they peruse through that material, and that can be onerous for a provider who's very busy. And we've also had multiple changes. So they learn this system and then there's a new system. So they have their challenges as well. However, we do have some things in place to help with that. We have a team member who is available when these concerns arise to help those providers understand or answer additional questions they have. I have also fielded those questions myself, and I have a position that I'm trying to fill right now. I know that doesn't help you in the moment, but am recruiting for a position who's going to help work these issues as well. So I think the process is ongoing. That's what I can tell you right now.
Is there a way I could get contact information or something for that person to give to the local doctors? There's only a few handling like this whole area. So if there was a better venue for me to hook people up with so they could get that information.
So this is Dr. Kamenetsky. I just want to point out that I believe that you might be in the catchment area for the Spokane VA. And so our facility doesn't serve your area. So we can certainly put it on the list of follow-up items to see if we can put you in touch with the right people at the Spokane VA is what I would recommend. Because I worry that we'll give you our number, but your veterans are looking for their local VA contact information.
Right. Actually, I meant to give to the doctor's office so she could contact to get, whatever information she needs.
Right, and that would so that would be for the Spokane Community Care Office to reach out to them.
Okay.
Is what I was saying. I just worried that we'll give the wrong numbers to the physicians and they'll just be really irritated when we tell them we're not the right folks to talk to them.
Yes.
I'm sorry.
So Caroline, if you don't mind sending me an email and I will forward that to Ms. Begasi and they'll give you the correct information for that person. So next,
This is Chris Vanderwalker. Can I just respond to this thread just very briefly? I do think there is some confusion because I do know that Puget Sound has a cluster of patients in the Okanagan Valley. I take care of a gentleman who lives in Republic, Washington, which is in that neck of the woods. And there's a lot of people for whom they're very equidistant between Spokane and Seattle. And so we do have a population on the east side that I think will see a lot of community care come in through Seattle providers. So I don't know how to resolve that, but I can imagine that only adds to the complexity.
Okay,
yeah,
thank you so much. Thank you, Dr. Vanderwalker, for correcting me. I did not realize that. So it sounds like it's even more complicated than I thought.
Okay, next up, AMVETS National District. That's the name that's showing right now. So you're up. Whoever that AMVETS National 6th Commander. So I don't know who that is.
Lisa?
Yes, go ahead.
Yeah, this is Chuck Wharton, Commander for AMVETS Post 1 in Tacoma. I am the National District 6 Commander for AMVETS. That's 10 Western states. Sorry, I never told you.
Oh, okay. Go ahead, ask your question.
All right, Dr. Kamenetsky, first off, my compliments on the procedures I have seen in place last Friday and last Monday, both at Beacon, both at Beacon Hill and at American Lake for the vaccination process. I got my Moderna first shot in Seattle on Friday. My first question is that will there be an increase in personnel that will allow more vaccinations sooner? Do you have the people? And if possible, will you be adding other locations, i.e. the outlying clinics?
Thank you. I can answer part of that, and then I'm going to ask Dr. Best to help me with some of that. So I'm glad you had a good experience of your vaccine and vaccination. Right now, it's actually not personnel that's the limiting step, it's vaccine. And so when we were getting about 2,000, I think, doses a week, 2,000 to 3,000 a week, we were, I will admit, with big eyes, wondering, how are we going to do this, right? And we did get a big kind of unexpected drop of Moderna, 2,700 doses. And, you know, when we get something like that, you want to put that into the correct arms very quickly. That was a lot of pivoting to get the staffing for that. And we're back to about 1,000 doses a week-ish to cover all of our sites of care. And that is not hard to do with the personnel that we have currently. That being said, there is a contract that's being put into place to get some EMR folks, emergency techs in to provide some support, personnel support. I don't have a date as to when those folks will be boots on ground, but we will be getting some of those for both Seattle and American Lake. And I do know that there are plans in place to send the vaccine to additional sites of care. We have, and so I think I'm ready to turn it over to Dr. Best to kind of talk about the expansion of sites. Yeah,
jumping
she's
up and down.
waiting
I'm so glad you asked that question. So yeah, to echo Dr. Kamenetsky, right now our rate limiting step, the bottleneck is on the number of shots we're getting to give out. We get them out the door as fast as we get them, and our motto is that a vaccine in a freezer does not help any patients. So we want to get them to the patients that need them. And so, yeah, when we get more, we will figure out a way to deliver more. The other question I think is also very important, which is how do we make sure that our veterans in all areas of Puget Sound get access appropriately to the vaccines they need. And so to do this, we are using data to look at where do the highest concentrations of veterans live that are, you know, where maybe they don't have access to vaccine. And we're talking about using our mobile medical unit strategically to send it to areas where the access may not be as good, where there's transportation barriers or where there's large numbers of patients that aren't able to make it in. And we are currently doing on-site vaccinations in select veteran homes for veterans who are participating in home-based primary care. And we have active vaccine clinics in Silverdale, so out on the peninsula, and then in Mount Vernon to try to get the vaccine out to some areas where we know that there are long drives. So those are hopefully answers your questions on our outreach efforts for rural veterans and into the farther areas.
And I'll just point out that for those veterans who are getting their vaccines in their homes, these are homebound folks who cannot get out and really have a hard time coming in for any kind of medical care. So we have a home-based primary care program, and those providers are providing vaccinations to those veterans. Mm-hmm. Did we cover your questions, sir?
Dr. Kamenetsky and Dr. Best, yes, that was very good. Thank you very much. And I've seen the notification by Christopher Vanderwerker that the AMR arrives on Monday. Great news. Thank you very much.
It's very exciting.
Do you have a follow-up question, Chuck?
Well, my only follow-up question would be, as a 43-year outpatient of the VA, both in Washington, California, Arizona, Ohio, Texas. I've traveled a bit in the last 43 years, and they've always taken fairly good care of me. And I've had a few complaints along the way, but first off, my compliments on the expediency and the efficiency for getting as many people vaccinated as you possibly could. At the same time, I would throw spitballs at you for the backlog of customers, and I understand the number of personnel you have versus the workload you get. There has a big effect on efficiency. I've seen it post-Vietnam. Now I've seen it post 1990 sandbox wars, and now you have a large customer load and not as much money or as many people as you'd like to have to take care of things. The Tri-West website I found to be a very good source of information. And I think that the billing problems with providers that are referred, when a VA patient is referred to community care, I had back surgery 2.5 years ago. It took me 6 months to train the provider's billers. And The last visit I had to an ER was August of last year, and that was the Catholic Community Hospital System in Puget Sound. And I had to once again provide them with the billing address in Tampa for community care. And I'm still waiting for the rest of the laboratory providers and the ER doctors billing agency to contact me. I don't know if you can provide enough information to Tri-West, but I think perhaps you might consider an alternative method of educating private providers billing agencies. There's got to be some way that you can contact the majority of these individuals nationwide, because as a national district commander, I receive conversations and emails from all across the United States, and every VA guy I know says we're doing our best, and just like you are. I mean, you guys do, you're fighting against a rising tide all the time. But when the same problem exists nationwide, and it's not within the VA, it's not really within Tri-West, it's the providers who don't ever seem to know where to send the bill. The hospital in Lakewood here in Tacoma tried to send my ER bill to TRICARE when I personally handed my VA ID card to the billing clerk and said, I'm a VA outpatient from American Lake. Do not send it to TRICARE. Yep, they send it to TRICARE anyway. If I had a magic wand, trust me, I'd wave it. But you're the only one I know of who might have a magic wand if you can figure it out. So thank you for listening.
Oops, thank you for the feedback. Appreciate it.
Yeah, the next step is
Did you say Caroline Wood? It cut out.
Lisa,
Hello?
can you restate that? We couldn't hear you.
Oh, Caroline, you're next.
Thank you. Are you able to hear me? I'm using a headset.
Yes, go right
Great.
ahead.
My name is Caroline Wood. I have been with the VA receiving care since 2008. In that time, I've been very pleased with my care. I've only struggled in the past 6 months with referrals to community care network, and the transition from the previous program to the CCNO office has been a real struggle for me. I just wanted to say I received a call yesterday saying that it was an automated line. When I answered, they said, "We're sorry we missed you." It was like a recording, and they told me that they were sorry they missed me and they would call, or I should call this number, and then it hung up. So I called the number and I waited on hold for an hour, and then it said the system is not available, and it hung up on me. And that was just yesterday at the number for the CCNO office. So I guess my feedback would be is I can appreciate that there's a backlog that the staff is working through, but the fact that there's no voicemail system, that the hold music plays on a loop every 45 seconds for an hour and then hangs up on clients that are calling, that's extremely frustrating. When the office is sending out automated calls telling clients to call because their referral needs to have conversation, but then there's not a person on the line, I'm not sure how to follow up to get my referrals in place. Do you have some advice for me? And I think this is for Susan.
Well, I'm happy to attempt to answer that question. That automated call that you got, there's something is wrong with it, because clearly, and this is the first time I've heard this issue, but what's supposed to happen when you get that automated call is that it's supposed to say, "We're sorry we missed you, and if you would like to talk to someone right now, you can press this," and then you would be transferred to a person. And if you want to schedule an appointment later, you press something else. And then there's another option if you don't want to receive any care, or you've already had care, you press a third thing. You obviously did not get those options. I am going to have to investigate that a bit. And I will take also your comment to the loop of music to heart too, because I know how if you're already waiting, that can be so annoying. I'm just thinking maybe I'd like to just have a way to connect with you afterward after I follow up. Is that possible?
Yes, I could put either email or phone in the chat, or I think this is my first time using Teams, so I don't know if I can message you my information.
Yes, yes.
Yes, you can. So just put it on chat and just look at for Miss Susan Willard's name, and then you can send your information to her privately.
Okay, I'll try that. Thank you very much for taking my feedback.
Thank you.
So our next stop is our director, Alfie. You have a question?
I sure do. Thank you very much. We know that the Puget Sound healthcare system, especially Seattle VA, is going to be one of the implementers of the Millennium electronic health record. And just would like to know very quickly, what's the status of implementation of the new electronic health record?
Thank you for that question. That's sort of the big question of the day. So Spokane VA went live with the Millennium Electronic Health Record in the fall, and much of it went as expected in terms of being functional. There were some issues with users getting the appropriate roles to be able to practice. And there were a couple of other things that they need to work out. They've actually got a number of work groups working on the product to see how to get that addressed. And in fact, we have some of our own staff who have been involved all along in trying to create some of these products and make sure that the way in which it's implemented works in a VA. They continue to work on these issues. So we don't really have a go live date as much as a season, I think, and that is for the fall of 2021. So later this fall. So we're just watching this carefully to make sure that the product is ready for a complex 1A facility such as ours. And it's one of the reasons why we like to have our people helping Spokane. We believe in running towards fires, not away from them, because it's coming this way eventually, right? So we just want to make sure that the product is right. And we're just making sure that that product is going to be ready for us at the right time. So we continue to work on it, taking care of veterans and making sure that these vaccines get into the correct arms is our #1 priority. So some of the work kind of gets filled in around the vaccination efforts. So we'll let you know if we hear anything different, but currently the date for us or the season for us to go live is sometime in the fall of this year.
Thank you.
Thank you. Next up is Ron Block.
Hello, how are you doing? First off, I'd like to say thank you so much for your presentation and your time. I would say I attend a lot of different meetings by Zoom for organizations. This has been probably one of the most informative meetings and well presented that I've attended in a long time. So thank you very much for your time and effort. There's a lot of information today, and I have a question and a comment. Is it possible to get notes from your presentation so that we can look at them later and kind of absorb some of this information, especially about opening of new facilities or housing or veteran outreach? There's just a lot of information. So that would be helpful. I've tried to take notes, but I can only write so fast. And also, I do have a question. I live in Pacific County in Raymond area, which is, as you know, is down here a ways. And we have very few, I only actually know of one community care provider. Most of our doctors have chosen to opt out of the community care and for their own reasons. They're not real fans of the community care program, to be quite honest. At least that's what they tell us. But I did get have a conversation with our one and only optometrist, and they said that glasses authorization is going months in some cases, and they're starting to give veterans who are coming in and putting the heat on them and demanding answers, and they don't feel it's their job to be have to buffer the veterans and have veterans come in angry because they can't be given an answer why a pair of glasses hasn't been authorized if the veteran's qualified. I didn't have an answer to it, but I did want to bring it up just because if a provider, especially in a rural area like mine where that's our only optometrist, if they're getting heat from veterans because they can't provide answers, they say they submit the claims for the authorization, but they don't get any follow-up. At least that's what they're saying. They just tell the veteran, well, it's been weeks. We did it weeks and weeks ago, still no answer. So that's a concern for them because they want to be able to tell a veteran something. But what I'm hearing from the lady who does the veterans claims for optical saying they're not getting a lot of follow-up or any information as to when that veterans claim or optical might be processed. So that's my thank you for all you do. I appreciate you. And that's just the one comment I want to make on behalf of our local optometrist.
Okay, thank you. I think I caught 3 things. And so I'm going to ask folks to go in order. So I heard your request for our notes, and I'm going to ask Tammy to answer that. I heard you say something about sort of limited access in your area, and I'd like Dr. Vanderwalker to address that. And then I think I heard a concern about optical access, and I'll have Ms. Willard address that. So let's go with Tammy first.
Thanks so much for the question, Ron, and I can absolutely do a recap and get that to Bob and Alfie. So in the hopes that they can distribute it out to all of you.
Yes, definitely. We'll do that.
Okay.
And then Dr. Vanderwalker.
I just wanted to say thank you. You know, I know previously we've been able to serve Raymond, Ocean Shores, Shelton, and other communities near the Pacific Coast with the mobile medical unit. That team hasn't been able to go out because of COVID-19, but I am excited that we're going to start a pilot of getting the mobile medical unit back out to your community. We're going to start with our Shelton location and hope to offer a trial vaccination run next week. So we are looking forward to getting services reestablished to the Pacific Coast area. And I just wanted to thank you for your patience during this time.
Thank you.
Thank you. And then Ms. Willard.
Sorry, I needed to unmute. So I don't think I can answer your question. I'm going to have to chat with you offline here. And if you want to put a contact number in the chat box, I would be happy to call you and try to get an answer for you, but I just don't have an answer right now.
Okay, thank you.
Next up, Mr. Padilla.
Yes, good afternoon. I just want to say, ask if I can answer a question about hospice.
Sure.
Yeah, the reason I had talked to about 4 different hospices. 2 of them want to talk to me, and the other 2 didn't want to. And one of them was the Olympia, because I do a lot of work with widows and veterans. And the issue is 90% of the times when a veteran is sent to hospice because he's dying. What happened is most of the time, you know, because of the mentality of the old veterans, you know, the wife doesn't know or he doesn't know. And what happened is when they send the intake paperwork from the VA to the hospice, unless the hospice belongs to we honor the veterans program, they will not know that, you know, he was a Vietnam veteran or whatever, all the information, conditions or whatever. So when they assign the social worker, you know, they go and try to help the family. But the problem we have is that I found out is about that when that veteran gets there and he's dying, a claim has never started. Then the veteran dies, and because there was no such claim open before he died, now the window ends without anything. And one of the things I was working with that hospice was they said they were not even aware of that. And what we were trying to do was have the social worker be in touch with a VSO, or have the family, or have a VSO, volunteer assigned to the facility, so they could, start the paperwork before he dies. Now, the other thing was, we were talking about, why does the doctor maybe send a referral to the social worker and let him know, look, this guy was sent here, he's dying, contact the family and make sure that he started a claim, because what's happening is, if the paper was not done before he dies, the widow will end with zero. And we sent that paperwork. I did a research, and like I said, that's what I did research, because I sent a paperwork to the Chief of Staff, Army Charge Social Scout, was I'm part of the board, to make sure that this issue was taken care of. And I don't know what happened, but it's just something that I don't think a lot of doctors or even facilities were aware of this, that if the paper was not started before he dies, the widow ends with nothing, even though it could be service connected or whatever, that from the condition.
Thank you for that information. It's very helpful. Do you have a sense for whether these veterans are referred by our clinics and our VAs, or do you think it's referred by private sector hospitals?
No, well, the two cases I had, they were sent by VA. Yeah, they were sent. Okay. They were sent to the VA, and yeah. And one of them, there was not. The other one, I was lucky enough that I was able to push it, and with the VA, I think, took mercy, because really by regulation, the way it's supposed to be, if somebody is in a state, they had to open a claim, and then when he dies, then the spouse comes and open another claim on her name for the condition, and that's how the process worked. But 90% of the time, we had found out that because the stuff was never, in the old days, the widows thought that it was automatically his benefit was his benefits. It is not true, because that's why. So there's a break in communication in the system, and I think the widows have been punished because a piece of paper. Even though that this veteran was in Korea and Vietnam, he had died from Agent Orange, and I had to fight with my teeth and my nails to try to get, because he got disapproved because the way they wrote also on the death certificate. So I had to go to Madigan, and just it happened that before he died, they had to do surgery, and he had cancer in 5 different places, and that's how she got his DIC. If not, they had denied it originally. So there's a lot of missed little things that when it comes to paperwork, that is not happening because the widow doesn't know. She's left out with no benefits, and I don't think we need to improve the system so we can bring them back up to what is happening now, not what happened 30 or 40 years ago, because that's the way that mentality of the old veteran was. And the Army, if the Army wanted to have white, they would issue one. That's the way they thought in those days, but now it's different. So we need to change that way of thinking and try to help that widow or that veteran that is dying.
Okay, I mean, it sounds like. So Ms. Willard, do you mind getting some information from Mr. Padilla so that we can, it sounds like we might need to look into some of these cases to kind of understand where the breakdowns are?
Yeah, I could even email the letter I sent to the Chief of the Staff of the Army, because that was my assignment. I was supposed to do a write-up and the recommendations to try to get this issue solved. Okay. So I sent her what I wrote. So it was part of the Chief of Staff of the Army, Miss Alfie, which is our chair. We had worked on it. And so so we already wrote the stuff and it got approved to be sent. So we just gotta make sure the stuff gets in the system. Yeah,
I think Ms. Willard has put her email address in the chat. If you will hook up with her, and we can find out if there what we can do on our side to make this easier for our veterans and their spouses. Okay, beautiful. Thank you. Appreciate it. Thank you very much.
Thank you so much. And next up, Rob Richards.
Hey, everybody. I'm Rob with Congressman Derek Tillman's office. I just want my note is sort of piggybacking off of our friend from Pacific County. We're hearing from a number of our constituents in our rural communities. We cover Grays Harbor, Clallam, and Jefferson counties, especially the coastal areas that are having struggles, especially in the time of COVID, accessing care in their communities. And we've heard from a number of providers also who are trying to get authorizations to provide care. Offhand, I can think of a pharmacist, a dentist, and a mental health provider who have reached out trying to get those authorizations and just aren't hearing back or are having some communication issues. And so I wanted to note that. And then I wanted to thank Christopher for his update on the mobile units, because we get those questions a lot too out in Aberdeen and Ocean Shores. And I'd love to see one go out to Forks someday. So thank you all.
So next up, Bob Wallace. Bob Wallace. Bob, you have your microphone unmute. Okay, go ahead, ask your question. You have your microphone unmute, Bob.
How's that sound, Alfie?
Yes.
That's good. I'm sorry. That's what happens when you start messing around. Anyway, your 3 clinics are going to be opening. Will they be able to give the Cova shots there, or they'll still have to go to the hospital to get them?
I think this is a Chris Vanderwalker question.
To be very honest, I don't think we have the answer to that yet. Those clinics are slated to open probably between, somewhere between late April and June, depending on COVID-19 delays with getting all the work done. I think our crystal ball more than like 2 weeks in advance around vaccine supply is so limited right now that, we just couldn't in good faith give you an answer about whether there would be the staff or the vaccine or the cold chain to support that. I can definitely agree that our aspiration would be to have as much vaccine as possible at all locations, but there's still so much unknown about what vaccines we'll get, when we'll get them, and what the requirements are that I think it'd be premature to answer that. Does that make sense?
Yeah, it really does. Thanks a lot. I appreciate it. My other question would be, do we have a set schedule for when COVID vaccines are coming in, the serums are coming in, or is it just by golly?
Oh, I can answer that. This is Dr. Best. Literally every week we get told what we're going to get for the next week. So I think there's a lot of flux in the national supply chain. So we are simply keeping up with, delivering whatever vaccine we are given. And we don't get a lot of advance notice, unfortunately, although we would appreciate it if we did. So if you have any pull with the CDC, please use it. No, I'm just kidding. But basically, we only know a few days to a week in advance, and then we work to distribute those doses as quickly as we possibly can.
Wow. Thank you very much. I appreciate it.
Pleasure.
Okay, next is Sean Dornan. Sean, you're muted, so you have to unmute your mic.
Sorry. Thank you. Sorry. Thank you, Lisa. I just really want to piggyback off one of the questions Bob originally asked. So I know that we don't have enough staff and vaccines for like the new upcoming clinics, but will they be distributing vaccines at the existing clinics like Federal Way and things like that, or is that just not in the cards right now?
This is Dr. Best again here. Let me put my video on. At this point, it's, we simply don't have enough to open up more sites. And so we hope to be able to do so, especially if we get vaccines that require different cold chain parameters, meaning like if we don't need to use the deep freezers and such. But at this point, what we have is is the main sites that we're going to be using until we get either more vaccine or a different type of vaccine. And
Estoy en una reunión, te llamo para atrás, ¿sabes? Estoy en una reunión, te llamo para atrás.
A little background noise there. But yeah, we are expanding to outreach to as many rural places and to try to cover the region as best as we possibly can using the sites that we have. So again, Mount Vernon, Silverdale, Seattle, Tacoma, and then limited in-home, and then outreach to other areas using the MMU as we are able. And then as Dr. Vanderwalker pointed out in the chat, we have a limited partnership with Clallam County as well to deliver vaccination in Port Angeles, and depending on the availability within Clallam County. So that's that's what we're working with at the moment, but we hope to expand if we possibly can.
If I needed, thank you.
Yeah.
If I needed more information, I appreciate that. If I needed more information about some of my clients who I have who are pretty much homebound, and they needed access, my elderly veterans who needed access to, say, get that outreach you're talking about to their location, who would I reach out for that? And I'm out in the Tacoma area. That's why I asked.
Yeah, so actually this has come up quite a bit.
Oh, you're muted.
That's the story of my life. Okay, so to answer your question, the veterans who are able to get the in-home vaccination are the group who are receiving home-based primary care services. So if your veteran falls under that category of participating in the home-based primary care program, then that's one route you could use. Veterans who are eligible for beneficiary travel are eligible for transportation to get their vaccination at one of our sites. And then finally, if there is a site that's closer to where they live, they can utilize one of the Department of Health, like Washington State programs as well. There's absolutely no restriction like that you have to get it from the VA. So those are the basic options. And we're always looking to expand, outward from there. But at this time, those are the options.
All right. Thank you so much.
You're welcome.
Gail, you're up next. Unless, Sean, you have a follow-up question.
No,
Gail?
Lisa, I'm good. Thank you.
All right. Thank you, Gail.
I have a question about being able to visit veterans in the WDV veteran homes, and also when they'll be open again, and also when will veterans who live there be able to, like take the bus downtown to go somewhere to do something or whatever. They're kind of like not imprisoned there, but I mean, I haven't been able to see any of them, and I used to volunteer there quite a bit.
Alfie, did you want to take this one?
Yes, I can answer that question. The veterans' homes are not unique. Every single nursing home, long-term care facility in Washington State and across the country is pretty much in the same condition. Our residents, at least over 94% of them have received the vaccination. Our staff is still yet to be able to continue in that process. So until we get clearance from the Department of Health or the hospitals of jurisdiction, the health departments of jurisdiction, and that's the county, to be able to start opening up, we're going to continue closed. Meanwhile, our residents have the opportunity of being able to see their loved ones through video visits and visitors. You could arrange for video visits with residents if need be to make sure that they have that social interaction that is not the same as being able to have a personal visit, but at least has that human contact of some kind. But we will not be able to open to volunteers or visitors in general for probably another couple of months.
So I think I heard you say it's really up to the health department of the county that the thing is in. Okay. All
Correct.
right. Thank you.
You're welcome.
Is there any more questions from our attendees? Cassandra?
Yes, thank you. So I'm hearing a lot of programs and that kind of thing that are available for, I'm going to say, the per capita veteran population that's around Seattle, primarily the west side. Where can I get contact information for basically your guys' counterparts on the eastern half? Because I don't mind playing detective and I don't mind tracking stuff down, but I really just need a starting point. Who I should be talking to on this side. Even if I get the wrong phone numbers for people on your side and they can give me the right phone number for the people on my side, I'm cool with that too. But I just need a starting point. It was one of the reasons I attended this, was because primarily the mental health stuff and the suicide prevention and the community care, because we are so isolated out here.
So I would, Tammy Bagassi, would you be willing to take point on helping Ms. Clark? Because it sounds like she needs contact information for like several different programs.
Yes, I noted that earlier, and Cassandra, I'll loop back with my email very shortly, and just we can connect and I'll get you everything I possibly can.
Marvelous. Thank you. I appreciate it.
You betcha.
Chuck, you have your hand up? You're muted. You need to unmute your phone. Okay, there you go.
Thank you for the reminder. This is for all of the VA personnel on the call right now. As a former chairman of the Governor's Veterans Affairs Advisory Committee, I'm a veteran of many in-person and now the last year online town halls, and I would like to compliment all of the VA staff on a very comprehensive, detailed, and yet efficiently delivered information process on today's session. I believe Alfie and Bob Wallace may probably agree with me. This may be the most information I have received in a short period of time ever. Thank you very much for your professionalism today.
Well, thank you so much for having us. It was our delight to share information with you all, and we would be happy to do this again in the future if that would be helpful.
Yes. Are there any questions? If not, I'm gonna ask a question. So I started going to the VA last year to receive my care, and I have excellent care at the VA. And my sister is one of the primary care provider at the American Lake. So my question is, I know they will be opening CBAC here in Olympia. I live in Olympia, and the last time I spoke with my provider, because my sister told me, hey, you might want to enroll in Olympia because they're opening a clinic. So I know my fellow veterans is gonna ask the same thing. I asked my provider if she can refer me to get my care in Olympia when the clinic started opening or taking patients. So how soon would I be notified that that transition is happening or is not going to happen? How am I gonna be notified?
Dr. Vanderwalker, do you want to take this question?
Absolutely. Yeah, so thank you so much. So we have the first step, when we opened our Puyallup Center, that really was a transition of our Federal Way clients. We're transitioning from Federal Way to Seattle, Puyallup, and American Lake based on their preference. And in Edmonds, in Lake City, it was a really one-to-one. In Olympia, we're really expanding into a new area. So the first thing that we have done is most of the staff that went to the Olympia Clinic actually were primary care providers at our American Lake campus, because we actually have a lot of staff at American Lake who live and work in the Olympia area. When the first folks who went were patients already enrolled with those staff, we are literally in the process this week of mailing letters to all of our patients with zip codes in the Olympia area, letting them know that the virtual clinic is now open, meaning we don't yet have a physical space, but if you wanted to transition your care, you're invited to do so, and we have many openings at that location. That process is happening right now. There will be a subsequent outreach when we're actually getting closer to doors open and we have a physical place to hang our shingle, and then we'll do continued outreach. So over the course of the next 2 weeks, if we do nothing more than just this conversation, you should be getting a letter if you live in that area. But I'm happy to also follow up with you to expedite that. So this is a new process for us. So it may take a little bit of time, but we are wide open in Olympia, and we would love to accommodate any veteran who desires to be seen there.
Thank you much. I know a lot of women veterans that are from this area, Yelm and Tumwater, Tenino, and the Olympia is a blessing. Thank you.
So Lisa, if you want follow-up from Dr. Vanderwalker, you might want to put your contact information in the chat because you're showing up as Alfie.
Oh, okay, I will.
Yeah.
Thank you. Alfie, you're up next. Sorry.
Yes, I would like to spotlight and for him to introduce himself, our awesome deputy director who joined us just a little bit ago.
David, you muted yourself. You have to unmute. Okay, there.
Lisa?
Yes, sir, I can hear you now.
I'm sorry. I stepped away for a second, so I apologize. What was it, the question?
Alfie was introducing you, and she's giving the floor to you right now. And on the call are the STEAM lead, the Deputy Chief of Staff of the VA Puget Sound, and the various.
Lisa, I think you just muted yourself somehow.
Sorry.
Teams plays these games on us all the time.
Yeah. So with us, David is the Chief of Staff of the VA Puget Sound, Dr. Kamenetsky. Hopefully I said that right. And the various heads of the different like primary care for homeless veterans, mental and suicide prevention, community care.
Uh-oh, Teams is playing a number on Lisa again.
I just wanted for David to introduce himself.
Yeah,
David, can
was-
you introduce yourself? I just wanted for people to see you.
Yes, ma'am. Thank you. And I apologize. I have been listening to the session. I've just been trying to do some other things. Somebody walked in my door. So good afternoon. My name is David Puente. I'm the Deputy Director here at your Washington Department of Veterans Affairs. It's an honor to be here and welcome to everybody to listen to this town hall conversation. As Alfie indicated, I am, well, I don't know if I'm new anymore. I've been here over a year, so 13 months. So it's been an honor and privilege to join the organization, to work with Alfie, and obviously the mission in supporting our veterans and their families. So thank you very much for allowing me time to introduce myself.
Bob Wallace, you raised your hand.
Yes, I think I unmuted myself, I hope. Chuck started the conversation. Basically, I've really enjoyed this. We've got more information probably within the last hour and a half than we've had in over a year. And I really appreciate what WDBA has done to accomplish this. And I also like to thank everyone from the VA hospital that has contributed to this town hall meeting. Thank you.
Yes, thank you so much, Dr. Kamenetsky and crew. Tammy, thank you for making this happen for us. I thought I know quite a few, but I learned a lot today. So I know now how to refer people when I get that call. And I think there's a last minute question from Chuck or comment.
Yeah, just a last minute thing. Mr. Wallace triggered this thought in me, and I wanted Dr. Kamenetsky to know, and also all of the other VA personnel online, to be aware of the fact that the members of the Governor's Veterans Affairs Advisory Committee are representatives of all of the organizations who are your customer load at the VA. So if you are having difficulty getting information to your customers, you feed it through us, because we have all the inside emails at all the VSOs in the state. Feel free to utilize our information dissemination service anytime.
Yeah, that's very true. Alfie, any last parting words? Alfie? I guess.
Hold on for just 1 second. Yes. I just want to echo what Bob and others have said regarding the amazing body of information that has been shared with us today, and hope that we can start somewhat of not a tradition, but to be able to continue doing this on a regular basis, maybe once every 6 months or so, and be able to get that information that is so important for our veterans and their families to be able to get. Again, we just want to thank our Puget Sound Healthcare System team for devoting such an amount of time, because we know you're very busy people, and hope to be able to see you in a very near future. And I will turn it up to the chair to be able to close the meeting.
Bob?
Yep, I'm on. All right. Thanks, Alfie. And again, to the VA hospital system, we really appreciate it, what you've done. We really appreciate all the information. I've got about 5 or 6 pages of notes that I have to try to figure out what I've been doing. And but again, thank you very much. It was indeed a pleasure to meet with you, Doctor, and to meet with everybody else. Thank you.
Thank you so much, Dr. Kamenetsky and your crew. You guys are awesome. Thank you.
Thank you so much for having us. And Lisa, thank you so much for organizing all the folks on the call.
Yeah, until next time. Thank you.
All right, bye-bye.
Goodbye, everybody, and have a
Thank
good
you much.
afternoon.
Appreciate it.
Thank you.
Thank you, bye.